now day 7, 1 week out from my anterior cervical discectomy, replacement and fusion surgery from C3-4 all the way down to C5-6. So for those of you that love comedy, I recorded this video a few minutes ago and somehow accidentally hit time lapse instead of video. So unfortunately there's no audio, or I'd post it because it's probably pretty funny. Anyway, doing pretty well overall, as you can see. Been off the pain meds since day 3, taking Tylenol over the counter, 500 milligrams, 2 to 3 a day, just to kind of see, you know, what I need, mostly for just the aching as everything heals in there. So not a whole lot of complaints there. A few things that have subsided are the sore throat has thankfully subsided a bit. Having the applesauce and the popsicles, that advice from other people was really helpful. And who doesn't love an excuse to have a popsicle? So the sore throat is pretty much gone. I still, when I swallow, feel like I'm swallowing a large grape on the right side. So it's still a little uncomfortable feeling, but there's no pain or soreness. It's just awkward and something that nags at you. You just kind of want it to go away. I'm told it'll go away over time, so looking forward to that. So here I just wanted to show a quick close-up of the area. The steri strips are still on, and the area is still pretty numb, but you can see that it's turning a little green, bruising a little bit. But as far as I can tell, the incision itself is fine. There's no infection. It's just that the area from 1 week ago, you can tell that it's been traumatized, obviously, and bruising a little bit, but it doesn't hurt as much as it looks like it should. I also showered again today on my own. I was able to blow dry my hair, which was kind of nice. If you're independent like me, that's a big deal. I don't like relying on others to do things for me, so it's kind of nice to be able to do something like that on my own. I will say I was a bit achy, having both arms raised over my head, trying to blow dry, so I just kind of took it slow. Did the best I could, and we'll just keep working on that. One thing I've noticed over the last couple of days is that my mid and my low back are actually aching a lot more. I suspect that it's, they're taking the brunt probably of trying to help so I don't move the cervical spine a whole lot, let that heal. I did notice that in my left leg, my 2 outer left toes go a little numb sometimes when I'm walking or sitting. That's kind of a strange sensation. I haven't had that since I had my low back surgery 10 years ago. Again, I suspect that because everything was so close to the spinal cord and the cervical area where they were working, that it's just kind of, everything's kind of waking back up and trying to heal. So those are things I'll be asking the doctor about next week during the post-op appointment for sure, just to make sure nothing's wrong, make sure it's just all a part of the healing process. The other thing that you may be able to tell when you're watching the video is looking up is a little difficult. It's not painful. It just feels really awkward, and it may partially be the steri strips kind of pulling and tugging on the skin, but it also feels like there's this large lump in my throat when I swallow, like I mentioned earlier, like swallowing a large grape. So it's a little hard to look up. It's just an awkward feeling and something you don't feel like you want to do for very long because you're just not sure, is that a good thing? And it's just kind of a strain. I also noticed the steri strips are still on at day 7, despite showering several times. The doctor did say to let them kind of come off on their own. I think they will probably within the next week or so. So I haven't really had a good chance to look at the incision yet to kind of see what's going on there, but you can see some bruising up close. There's a little bit of a light green color from, all the work that was done in that area. So I would imagine over time it's going to heal, and some of the numbness will hopefully go away as well. But hopefully soon be able to get a look at the actual incision area and see how it's healing and what it looks like coming together. One of the other things I wanted to talk about was sleeping in the recliner. So for the first 6 nights, I was mostly in the recliner. There were a couple nights where I got frustrated and walked upstairs and tried to get into the bed. I have an adjustable bed, so I was trying to find a comfort level, how to get in, log roll over, put pillows everywhere, sit up. I just wasn't sure what would work to get comfortable. There wasn't a whole lot I could do in the bed to get comfortable, whereas the recliner was, I trusted it more. to, bear my weight and the electronics, so I could kind of, bring it up, put my feet up and down, things like that a lot more quickly than I could in the bed. And plus you're sitting up in the recliner, which helps. So last night I did go lay in the bed. I was able to put a towel behind my back and a pillow between my knees, and I was able to actually lay on my side. Found just, kind of that sweet spot, if you will, with the adjustable bed. And I was able to lay on my side for about an hour and a half, 2 hours, and actually fall asleep. I slept pretty well. The only issue was that I noticed I would wake up every hour and a half or 2 hours and my side would start to hurt that I was laying on. So I would just have to kind of readjust and roll over and lay on that other side. So I did a combination of that last night for about 6 hours of sleep, just kind of rolling back and forth. And then once my husband got up for work, I went down to the recliner, took a little nap on my back, which was kind of nice to kind of go back, get more of a comfortable position. So I'm just going to keep trying to do that until I can transition 100% into the bed and not have to rely on the recliner anymore. Would be wonderful. So when I go see the doctor next week for post-op, he'll be taking x-rays of the area to kind of make sure everything's in place and setting well, and hopefully start to see over the next couple of months growth, bone growth and fusion in the area so that everything's kind of setting well. So it'd be nice to get some initial pictures and see what everything looks like in there, but also kind of watch the progression over the next couple months. Hopefully also I'll be getting the clearance to go back to work in a couple of weeks. I'm not the type of person who likes to sit around. Want to be useful, and if I can go back to work, that would be wonderful. So looking forward to that as well. If you like these updates, hit the like button and subscribe.